Assalamu alaikum. Let's jump into developmental dysplasia of the hip. It encompasses a spectrum of conditions involving abnormal development of the hip joint in infants and children. It arises from abnormal contact between the acetabulum and the proximal femur, disrupting development and resulting in instability of the hip joint. Genetic in factor female sex 2 to 3 times more common in the females. There may be first and second degree relatives of those with the DDH are at higher risk. If we look at the infant, there is newborn hip instability with Barlow and ortholamina, asymmetric skin fold, inguinal and thigh asymmetric female length positive Galeazzi test, and older infant with limited hip abduction with 90 degrees of flexion. In case of toddler, there may be LLD, leg length discrepancy with limping or Trendelenburg gait. There may be excessive lordosis, prominent greater trochanter. How we can diagnose? If age is less than 4 months, hip ultrasound is preferred due to ability to visualize the cartilaginous structure. The femoral head and the acetabulum are not sufficiently ossified to visualize on radiograph prior to age 4 months. If age more than 4 months, hip radiograph help assess joint alignment. Given that the femoral head and the acetabulum are now ossified and can be visualized. If we look at the management, if age less than 6 months, if age is less than 1 month, mild laxity may be monitored for spontaneous resolution. But age less than 6 months, a pelvic harness, a splint, maintaining the hip in a flexed, abducted position to maintain proper alignment is recommended. If age more than 6 months or failed abduction, splint, closed or open reduction of the hip joint. How we can prevent? We can prevent by reduced by limiting external mechanical force that put the hips in adduction and extension, improper swaddling and narrow base car seat. And prognosis, early detection and treatment of the DDH is generally yield favorable outcomes. Untreated can result in persistent hip instability, gait abnormality, and early onset osteoarthritis.